Good afternoon, everybody. I hope you're having such a wonderful Thursday. Welcome to day 67 of the 90-Day Share. My name is Dr. Brooklyn Storme. I'm the Director and Principal Psychologist here at Cerebellum Consulting. What I wanted to talk about today was labels. So, a lot of the time, hi Sasha, how are you going? Hey Rachel. A lot of the time in psychology, sometimes we get people coming along and saying to us that they're really concerned about getting children tested because there's a fear around a label. And, as a psychologist, I want to try and understand what parents' concerns are so that I can help them address some of those. So one of the things I guess that is a big concern is stigma. It's 2017. We know so much about psychology now. We know so much about mental health. We've got psychologists out in schools. We've got psychologists in medical clinics. We've got so much happening online for mindfulness and, kids doing yoga and workshops and all of this sort of stuff. So it still surprises me to see the level of stigma that we do have in the community. And it's something that, as a psychologist, I'm trying to reduce myself by doing these videos every day. I want the world to see that I'm an everyday person. It's just I have a different job to you. And my job is to help people understand themselves a little bit more so that they can achieve their goals. And I guess while there is stigma in the community, if we keep hiding from it, we're not doing anything really to reduce it, are we? But that's a whole other story. I guess in counselling and in psychology, there is a value in a label. We probably don't call it a label, we call it a diagnosis. And for us, the value in having a diagnosis is it means that we've had to take the time to try and understand what's going on for your child. We've had to try and understand, all the history, all of the factors that's going into why this child is behaving a certain way or why they're experiencing certain types of symptoms. So we have to arrive at that understanding by doing things like talking to mums and dads about, whether or not the pregnancy was a good one, whether there were any complications, were there issues at birth, did this child hit their developmental milestones, when did the concerns begin. We need to understand all of this stuff because it gives us a better picture of perhaps where this child's behaviour might be heading towards the future. Early prevention is definitely key and so important in terms of capturing symptoms and managing behaviours and changing them to be healthy. I can't do that, and lots of psychologists can't do that if we don't actually know what's going on. So we have to make a diagnosis so that we understand the cluster of symptoms, the cluster of behaviours, because for each different set of symptoms and behaviours and each different diagnosis, there's a different treatment plan. So I guess if we don't have a diagnosis, if we don't know what's going on, it makes it really hard to treat. It's like going to your doctor and saying to your doctor, look, I don't feel well, but don't diagnose me, but give me medicine. The doctor has so many medicines that he can choose from, but he's not going to know what to choose if he doesn't assess you and figure out what it is that's happening to your body. It's the same in psychology. We need to understand, and that for us is the value of the label. And wherever we can, we keep all of this information private and confidential 100%. There are limits to that, of course, but most of the time we keep it in-house. If we need to share that with schools, we'll ask you for your permission to do it first. If we need to share it with pediatricians and doctors, we'll ask for your permission to do it first. If you want us to share our findings with them, we'll ask your permission to do that. So I guess if you want to get really tailored treatment with a really good, possibility of helping your child then we need to know what their symptoms mean, and we can't do that unless we've done some kind of assessment. And that is the value of a diagnosis. I understand in the community it's really hard because people think, oh, if I have my child diagnosed and then they've got a label, that then they're going to go to school and they're going to be discriminated against, or maybe they're not going to get all the advantages that they need. And I understand, and that's completely valid, and you're right, there are some kids who are bullies and there are some adults who are bullies and pick on kids, but by and large it can be really helpful if schools have the knowledge of what's going on, because it helps the teachers teach your child better. If we know that your child has maybe ADHD or something like that, that's helpful for a teacher, because the strategies that the teacher uses to support your child's learning in that situation is very different to if they just think your child's being naughty. If they think your child's just being naughty and misbehaving, well, they're going to get consequences. And that's not going to change anything. It's just going to probably escalate or exaggerate the negative behaviours that you're seeing. And in something like ADHD, there's not a whole lot that that child can do about that. So schools can help teach your child in different ways. They can support your child in different ways if they know what's going on. If they don't know what's going on, nothing's going to change. And you can be at risk, I think, sometimes of children perhaps falling behind or having trouble with peers, having trouble with their social skills and things like that, because we just don't know what they're dealing with. So also with schools, if your child is diagnosed with some kind of condition, whether it's a behavioural condition, whether it's autism, whether it's ADHD, maybe it's an intellectual disability or something like that, then it also opens up other doors for them with funding. So with autism, you know, there's thousands of dollars worth of funding that your child could be missing out on without having that diagnosis. And that's things like medical treatment, psychology, occupational therapy, speech therapy, and things like that. In a school environment, it's the program for students with disabilities funding that they're probably missing out on, and they're probably the kids that need it the most. So I think there's definitely lots to gain from understanding what's going on, and we can't do that without an assessment and a diagnosis. We want to help your children as much as we possibly can, and at the same time we want to protect them from any bullying and any stigma, and we'll do our very best to guide you around how to manage that, and to guide schools on how to manage that as well. But if you have any questions or comments about labels and diagnosis and stigma, I would love to hear them, because I would really love to help any way that I can. If you feel that your child might benefit from some extra support, or after today's vlog you're thinking, well, maybe I might want to have a chat with a psychologist about what's going on with my child, don't delay. Call us on 8765 2434. We're here to help 100%. We have the best interest it needs. Please, hey Louise, how are you going? It's nice to have so many people here today. My name's Dr. Brooklyn Storme. I'm the Director and Principal Psychologist at Cerebellum Consulting, and we're here to help. I'll look forward to seeing you soon. Thank you, everybody. Bye.